Welcome to the Java Cafe, Java fam. Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. I hope you are still able to appreciate seeing my face for a third time this morning. But as is Testimony Tuesdays, it's a true testament to information that is needed within our community when it comes to specifically today's session, sponsored by the Boston Medical Center, to talk with Dr. Thea James, who is not a stranger to the Java Cafe, but she is coming in today. We did a segment with some physicians earlier from the Boston area. We also had a young man and come in and talk about his personal experience with COVID and how the vaccine was able to make their plight a little bit easier. And so at this time, we're actually going to do kind of a little bit of a deeper dive with someone who is well known within our community in the city of Boston for a myriad of things in the medical industry. But I would like to present to some and introduce to others Dr. Thea James, who is back in the room in the Java Cafe. I am so excited to have you back in the room, Dr. James. But before we get started, listen, everyone, I need you to do me a favor. Go ahead real quick and hit the share button, because there's so much information, so much up-to-date information, that it is important that as I ask these questions and check in with Dr. James, it is important that we get this information out to our community. And so I'm going to ask you to take a couple of seconds and just hit the share button, invite others in so they can get this vital, important information. But Dr. James, how are you? How have you been since you were last on? I know you're working in the medical industry, and though we're not out of it, in some cases, things may seem better, in some cases not. How are you doing?
I'm doing great, Jimmy. How are you?
I'm a little tired. You're my wonderful, they say third time is the charm. So you're my third episode this morning. So I am doing well, but I'm very excited to be able to just check in with you, get an update so we can make sure that our community has this information that BMC has a long-standing history of doing and making sure that they engage with, our community. So, but thank you. I'm more asking about you, but I appreciate it.
Thank you. Thank you for inviting me. Happy
Absolutely.
to be here.
And so you're doing well. You're taking care of yourself.
I am.
Okay, I am glad to hear that. So the objective today, Dr. James, is to really do sort of a vaccine update. There's been, again, a lot of information, a lot of updates, because this is based on the most recent data and the most recent science. What is it that the Boston Medical Center, what do you do there in this vein of making sure we get information? What do you do?
All right. So I am Vice President of Mission and Associate Chief Medical Officer. And mostly, what I do is I'm really responsible for coordinating and maximizing our relationships and our strategic alliances with a wide range of organizations, community agencies, multi-sectors. Yeah, and multi-sectors, right? And so we also have a Vice President of Community Engagement and External Affairs. Her name is Trina Cherry, and she is leading a lot of the vaccination work we've been doing. I'm not sure the last time I was here, I think we had already set up a series of vaccination sites throughout the city. She helped us to coordinate and reach out to various different community leaders, as well as social organizations and ethnic groups and all types of people. And we mainly at that point had two things we were trying to address, because we had two problems. You know, we had hesitancy, and we also had access issues, because when the vaccination sites were first set up, they were not proximal to the communities that had suffered worse during COVID. So we set out to have the community help us to figure out where should these sites be, what should they look like, what should they feel like. And so that's what we were doing. And in terms of the hesitancy piece of it, we held multiple Zooms. And on these Zooms, we actually were answering the most frequently asked questions that people had. And so from there, from the community sites, we've now also expanded to, we have an entire calendar of pop-up events that are all over the city. We have a link that I can provide you with as well, so that you can actually see the calendar of where these things are. They're in schools and neighborhoods and things like that.
Okay. And it's funny because I was getting ready to ask you that question about where you can get the information. So I'll make sure that I get the link from you and we share that with the community where you can get the pop-up sites. So they are still around, because there is some belief that, we had the major one that was at the Reggie Lewis Center, and some people may not be aware that there are still pop-up sites. There are events that a lot of entities are working with community to make sure they get the information. And so, that's talking about the initial sort of shots. And as you are well aware more than me, where are things with the booster based on the latest sort of updates of what's going on with the latest data and science?
Sure. So, as you know, Pfizer was conducting, well, not only Pfizer, but let me just start with the booster in general. So, what might be confusing for people a little bit and might not be obvious is that when the primary vaccinations came online, there for Moderna and Pfizer, there was 1 and 2. And for people who were immunocompromised, people who had, diseases that made them immunocompromised, they actually were recommended to get a third shot because of their immune systems being immunocompromised. Their immune systems did not respond as strongly to the first two. And so they were advised to get a third shot. Now that's different from the booster. The booster is for other people, who completed their primary series, and recommended that people get this 6 months after the other ones, because what some of the studies showed is that the protection was waning a little bit over time, just dropping a little bit, and so it's also sort of like moved on to children now. The FDA has approved, children 5 to 11 years old to get to get vaccinated. And BMC was actually one of the sites for Pfizer's clinical trial. So we had children here enrolled in that trial as well.
Okay. And I'm glad. And I want to ask you specifically, the COVID vaccines were approved quickly because this was a worldwide crisis, but they were studied just as carefully under the same high standards. So to hear you say that, BMC was definitely involved in that. Dr. James, with all that's going on, how do I know as an individual the vaccination will work for me? I am vaccinated. Lord, I have to remember my 6 months. I have to go back and look, but I'll be due for my, booster shot. And thank you so much for clarifying, because I was not aware. There's a difference between the recommendation of getting a third shot versus the recommendation of a booster.
That's right.
Okay.
The other thing I should have said, Jimmy, also is that the booster is recommended for people who are eligible, and those people are people who are 65 years old and and above, and who are at risk for other diseases or have other diseases. It's also for people who work in certain industries, like medicine, for example, or places where you face the public a lot.
Absolutely.
And even people who live in long-term care settings as well, like nursing homes and things like that.
And the other piece I wanted to kind of go back a little bit is how do I know, well, back to my question, how do I know it's safe for me? And then I want to ask because, you have an advantage of being at BMC who was involved, with some clinical trials, but how do I know it's safe for me? And then how do parents, how do they know that it's safe for their children as well?
Sure. So in terms of, the science, the way it was done, many people, and understandably, people have been um, feeling not so good about the fact that, people say the vaccine was created so quickly, that it
Right.
was developed so quickly. And I want to say that there are two things that are really required to do clinical trials with vaccines. You need a lot of people and you need a lot of money. And because this was a pandemic,
World.
it was happening globally, we had both. There were a lot of people and there was a lot of money, available. That's one thing. So the second thing is the method that it uses, which is messenger RNA. It wasn't new. It had been around for a while, at least 10 or 12 years or so. And so that was readily available as well. And so the critical things that you kind of need to study vaccines, and which usually is why they take so long, because you have to get, like people and money and all those things. Those things were those issues were, solved, up front because you already had those things available.
On-
And so the way that the messenger RNA works is like you have this protein with the spikes on it, and when you get a shot, that protein, your body looks at that protein and it actually develops and forms like an antibody to what it sees there, and that's what the protection is. So when your body encounters that, that virus at some point, if you get infected, it knows what to do. It goes right to work, to address that, so that it can't, harm you and get into your body and make you really, really sick, and prevents people from severe illness and death as well. The vaccine is still doing that for sure. I've seen it myself in patients,
And I mean, you're a perfect witness there. And Dr. James, let's just name when I saw you at one of the opening sites at Morning Star, you were very transparent that you, as a well-informed, trained research person, had a little bit of hesitancy. And so I am definitely more confident now based on what you said, that I know it's safe for me. Just a little bit about, as we're getting now into it being approved for children, we had, it approved for young people 12 and up. And now there's an approval coming. How do I know that it's safe well, how do parents know it's safe for their children? You talked a little bit about the science. Can you say a little bit about what's the difference between looking at it in children and looking at it in adults? Why there's a difference? We heard
in
things.
adults.
Yeah.
I mean, the same rigor. They use the same rigor. The same rigor is applied in terms of studying the effects of the vaccine.
Yes.
So from that perspective, it's really not different, and it requires the same rigor, in order to be able to evaluate and come to a conclusion about whether or not the vaccine is effective and whether it's safe. None of the children, had effects from the trials that people needed to be concerned about or that were harmful to them. So that is what gave gave the FDA confidence that it was safe in children. Same rigor was applied.
The same rigor. And then one of the things that, for my own learning, and I'm sure the community wants to know as well, is why is there a variation in the study in the age groups, adults versus, a different study for 5 through 11? Is it because of just the simple fact that we know, not being physicians, that the young people's bodies are still developing? Why do they look at the age groups differently? Kind of off the question, but
it's just what you said. Young kids' bodies are developing.
Okay.
And they get a lot of shots, when they're young, in terms of, immunizations and things like that start relatively early in their lives. And so, looking at their immune systems and the immune systems of older people who also, are more likely to have other types of diseases and things going on, you just want to make sure that the effectiveness and the safety is the same in both age groups.
Understood. And you've already addressed some of these, but I just wanted to reiterate, there's some vaccine myths. There are a lot of myths about the vaccine and false information on social media. The vaccine changes your DNA. There's no evidence that there also, we want to say, and if you can affirm this, and I had a male doctor on some months ago talking about this, but I'll just keep it simple. It doesn't affect your fertility.
Not at
It's
all.
one of the rumors that were going around.
Yeah, no. Yeah, no, it doesn't affect your fertility. It doesn't affect your, your DNA. It doesn't change your DNA. I mean, nothing like that. Doesn't do any of those things.
Okay. And then me specifically, I got the Moderna, just to go back a little bit. And so you kind of covered this, but I should go ahead and get my booster 6 months out from when I got my second of the series, correct?
That's correct.
All right. And then but let's say, scheduling and whatnot. I mean, how adamant is it, or how important is it that we do our best to say, 6 months? If we go a week out, does it have to be the exact day or somewhere within a couple of weeks of 6 months?
A couple of weeks to 6 months would be fine. But the recommendation is 6 months after, but a couple of weeks would, that
Okay.
wouldn't be terrible.
I'm just thinking about that as far as, scheduling. And then, well, one thing I want to go back to, Dr. James, is you talked about the foundation before. This type of immunization is not new in medical science. Would you venture to say it's just that with rubella and measles and all those other ones, we just happen to not be alive when they were in a pandemic stage back in, long time ago before both of us got here? So along with the science behind this specific vaccination, we're okay with the chickenpox vaccination. We're okay with the other vaccinations. So along with the science, do you think the difference is just because we're here and people are actively seeing, the expedited research and things like that? There is a foundation for children and us to be immunized, and we don't fight against those going to school and work.
Right. I know. I understand. I do. I mean, I agree with you, but I also really understand how people might distrust things. How they might distrust the medical system. I mean, I am in the medical system, and as you said, I was transparent about it in the beginning,
Very much so.
because a lot of people, talk about Tuskegee, they talk about Henrietta Lacks and things like that, when they talk about distrust. But I think that the distrust is more about the experience you had in the medical system a month ago, 2 weeks ago, yesterday. You know what I mean? And so those things make a difference. And I don't know if we in healthcare recognize how we contribute to the the distrust that people have. And so I think we have to be more intentional and aware of how we engage, with patients, and and I don't think we're necessarily taught to do that in medical school. There's a lot of focus on disease when you're in medical school. People are not necessarily teaching you to engage with people who are attached to a disease, and not one thing fits everyone. Like there's a disease, and then when I'm talking about a disease, I'm not talking about pandemics and
Yes.
things like that. I'm talking about hypertension, diabetes, these type things. There are treatments that are, that we are taught to use to treat those diseases, but it's not the same for everyone. And I think, we should be engaging with patients, number one, to recognize and understand, and really try to understand from their perspective what this disease means for them, what matters to them, educate them about how best to treat it, but to also find out if they're able to do these things, if they want to do these things. If they don't, what would work for them. For example, with insulin needing refrigeration, if you don't understand or know that a patient has unstable housing, or homeless, where are they going to store this medication?
That's right.
And so they might not take it. Or another problem where people have congestive heart failure or other things that cause your body to become overloaded with fluid. and you have to maintain it with taking medications that diuretics that allow you to get the fluid out of your body. Again, if you don't have anywhere to live, you are less inclined to take the medication because you have to use the bathroom with great frequency. And so, I'm just saying there are ways to engage with people better, to understand what matters to them, what are their priorities. Some people are prioritizing survival and cannot prioritize health. And if you don't use the opportunity to find that out every time you're face to face with a patient, just listening to them, then, we are not giving ourselves or our patients the best opportunity to thrive and to be well.
Dr. James, I want to thank you in sort of in the vein of the transparency as someone who's a part of the medical industry to really name that has really been a key factor in some of the hesitation around not only, this vaccine with COVID-19, but in some spaces just in general. Another vaccine that, on one hand, we tend to be okay with is the flu vaccine. Now, I've had the COVID vaccine. Do I still need to get a flu vaccine? Yes.
Yes, you still do, because you're treating two different things. You're treating two different things. COVID is one thing and influenza is another thing. They're two different things. And so it's still recommended, that you get the flu shot. And particularly, once again, for people 65 and older and people who are immunocompromised. But I get the flu shot. It's also fine to get them both at the same time.
Interesting. So now I'll be honest with you. My transparent self, the first thing I thought was, double dose of potentially being down for a couple of days. Because the first thing we think is when we get the shot, next 2 days to 24 hours, we're going to be down. I really didn't go through with my COVID vaccine. And be honest with you, when I've gotten the flu vaccine, I don't really have an adverse impact. And one of the things I want to go back to, you say that doesn't mean it's going to be the same for everybody.
That's right. I was about to say that. It's not the same for everybody.
Each body is an individual and it's very, very different. And Dr. James being a novice in the medical industry, but some people may have not found out about their either, where there are small cases where some people may have had some different experiences with the vaccine. They may have not known that they had X, Y, and Z. That may have, caused a little reaction or whatever. And so it is, I think it is so important that we continue with these clinics, and we're going, toward the end, tell folks how they can go, what website they can go to get more information. But what are for those that receive the Pfizer vaccine, can we talk a little bit, and you did a little bit before, but be specific, people 65 and older, adults 18 to 64 at high risk of severe COVID-19 because they have medical conditions, and adults 18 to 64 at high risk because where they live, including long-term care. And so we just wanted to make sure that we keep reiterating that who that is available for, and who, where can they go get it, Dr. James? You all are still having the pop-up clinics, correct? Did we freeze? Dr. James may have had a bad connection there. I'm going to give it a couple of seconds to see if she bounces back. I'm not sure what happened. I'm going to give it a second. Maybe they'll have to dial back in. And I definitely am not trying to take up her part. One of the things that I wanted to make sure, or Boston Medical Center wanted to make sure that you all were aware of, it is easy to get the vaccine. You can do walk-ins and pop-up clinics, and we lost Dr. James. You can do walk-ins and pop-up clinics. They are available all over Massachusetts from BMC, the state pharmacies, and other healthcare providers. The vaccine is free. You will not be asked for an ID or immigration status. And to schedule a vaccine with BMC, you can visit www.bmc.org/get vaccinated. www.bmc.org get vaccinated. That is where you can go to get the information. It looked like there was a connection issue on Dr. James's end. And so we're going to wait a couple of seconds to see if she's able to pop back in. But what I wanted to do is share with you my own personal experience of getting the vaccination as well while we check in on the tech with Dr. James.
Well, COVID-19 has deeply hurt our community. I recognize that we needed to healing spiritually, healing emotionally, healing physically. That's why we knew we needed a vaccination clinic at 12th Baptist Church.
I just really had a lot of initial hesitation. From hesitation to education is how I got to a point of like being more hopeful. When I decided to get the vaccination, I really wanted to come here because I knew we had a site.
I was one of the first people when I was afforded the opportunity to be vaccinated, to be an example myself.
The vaccination will definitely change life. I want to get back to a life where I can be around my family and friends.
With every vaccination, we're one step closer to hope.
Join us, get vaccinated.
Have hope.
I told you all we would go to commercial and we would get Dr. James back.
Oh my goodness.
You know
I don't know what happened. I'm so sorry.
You're fine. You know what the old folks used to say? That ain't nothing but the devil because you giving out.
Absolutely. Dr.
James, I froze. I said, listen, I'm not the expert. I just started giving out the website. But no, in all seriousness, Dr. James, and we want to get as much as we get from you in case the signal acts up again. But it just sort of off kilter, just you and I. This, Dr. James, how important is it? I've heard a lot of language about, the concerns, but I've heard people like Congresswoman Ayanna Pressley and others that move in the economic space or just equity space. We don't want to be left behind. How do you respond to that everyone else, other popular, when I say we, I'm talking about people that look like you and I,
Right.
We don't want to be left behind as things are opening. And we still see that there are disproportionate impacts of not getting the vaccination on both sides, folks that look like us, and I'll say lighter than me. But just what you would say, as with all due respect, as Thea, what would you say to the community about how important it is, if you haven't got it, to get it? We're coming up in the cold, and then I'm aware of a possible Delta Plus, and then there's a Mu and we know that these variants are interesting.
I mean, I would appeal to our community, to first of all get the information you need, get educated, as much information and education about the vaccine as you need to feel comfortable. And get it from trusted sources, people who you trust. And I guess thinking about what happens to you, what happens to your family when something happens to you, for example, what role you play in your family, and also, what happens to them if they actually get infected, and what that means for your family. And I completely understand how people can be feeling resistant or unsure about it all. But I would say there are lots of people who actually have gotten vaccinated. I mean, Massachusetts has one of the highest rates among the states, is like 75% vaccinated at this point. And when I think about things that I would like to do to sort of like get back to normal, there are lots of things, being able to have social events, go to social events. I will tell you, the thing that made me decide, many, many months ago, back in December, was just thinking about all the people who had lost jobs, whose lives had changed, who are not able to take care of their families anymore, how that affected them economically, from an economics perspective. I mean, at baseline, there is there are disparities in economic mobility and wealth building, and median net wealth gap, in our city. And I thought about how the virus was making things worse, and people were having to get food from various different places, housing instability and this type of stuff. And so I understand as a physician what vaccines do in general, And what I felt was like, it's the least I could do. And I said that because I was still working. I hadn't like lost my ability to have a job. And I could not live with that, to be honest with you. That, that I was okay from that perspective. And many other people were not. I could not live with it. It was a moment of truth for me, quite frankly. And so I said, if anything's going to do this, if anything is going to like mitigate and eliminate what's going on, it would be a vaccine. And so that's why I took the vaccine. And immediately after I got the first shot, I felt relief. I felt so much relief. It was like immediate relief, which I didn't expect, but that's what I felt immediately.
I almost cried.
So,
I almost cried, Dr. James, because I wanting to see my mom. I would hug her and wear a mask, and we would do things. I see her in the community outside. But I remember when the shot went in, and I remember walking out of there after the first one, and I was just like, and let's be very honest. It gave you more confidence if you wanted to travel.
Right.
You know what I mean? And so that was a benefit of taking it as well. Dr. James, I know you are extremely, busy, and I don't want to hold you a long time. But I just really appreciate the fact that you and BMC thought it was important to engage on this sort of community driven platform to make sure that as much, and folks are going to are watching live, and then they always go back and watch more. So I think it's vitally important that we just reiterate that there are pop-up clinics still available. They are free. You don't have to show an ID. You don't have to prove immigration status. And so you can go to www.bmc.org, get vaccinated to find out information about the pop-ups. And also you can go to the state's website. I told folks earlier, in the city of Boston, they can call 311. In the state, they can call 211. There are a lot of ways for you to get the accurate information, and also to find out where you can go to get the vaccination, because we need hope. We need hope. And so, Dr. James, I really appreciate you. I'll give you time for closing remarks. What do you have? What are you working on? How can the community support you? The floor is yours to close out.
So, Jimmy, what we're working on is continuing the level of community engagement that we are presently having. I think that the setting up the vaccination sites was a proof of concept for us, in terms of having robust community engagement and having the community help us with things that we are that we would like to do, helping us to define what equity means for them, and how we can be a critical participant in that, achieving these things together. And so, in addition to just urging people, as much as I possibly can, to get the vaccine, when you're feeling comfortable, reach out to anyone, us especially, but trusted sources, to get any questions you have answered. But so that's one thing. But the other thing is, the one thing that this whole pandemic has done for us is to allow us to commit to very robust community engagement. And we've already been doing that since we started, with the vaccinations. I mean, we're using it for other things that will, be defined later on, or not be defined, but, we'll be able to talk about later on. But we're already doing it, and it's been wonderful. I mean, I've always said, like, the community is the greatest. It's our greatest opportunity to create and capture value with and for them. So it's been pretty amazing.
Dr. James, I'm going to go back and catch that exact quote and create a meme, because that is the essence of real equity when it comes to medicine. That is the real essence, creating with and checking in. And I love a few moments ago how you really laid out a process for which that the medical industry should engage their patients and whatnot. So again, not to hold you, Dr. James, because I know you're extremely busy, but I really appreciate the reach out to come back. And I'll end with this, and we ended on this last time. We talked about some of you mentioned equity. There's inequity within the LGBTQIA community, and specifically those that are, maybe HIV positive or dealing with AIDS. Are you aware of any either stats or numbers that where there is better access, where there may be certain level of community engagement? I'm sure covered under, your community engagement ventures there as well. But just, sort of just between you and I as a part of those communities, as we stated before, have you noticed any trend or any, have you noticed an improvement on the medical industry engaging that population? Let's frame it like that.
Well, I'm not sure about that, Jimmy. I don't want to answer that question without being, being completely sure about
Yes,
it.
ma'am.
Um, and then the next time we get together, I'll have an answer for you in
Okay.
that around that for sure.
Okay.
My spouse probably definitely knows.
Okay.
I mean, Reverend Irene Monroe, I'm sure she knows.
Okay.
But I will. I'll get an answer for you. We do have a center for transgender medical and medicine and surgery here.
Okay.
And so, we have an entire department, and clinical service for that population. And so, they would have answers as well. So,
Okay.
next
Dr.
time I'll
James,
be ready for you.
and I'm glad to hear you say next time. I look forward to, doing other things with you. And I really appreciate and thank you, Dr. James, for all you do in the years of commitment, from violence to the vaccination to naming inequities and giving instruction. You are definitely a queen and a legend in the medical industry, not just here, but across the world.
You're kind, Jimmy. I'm just grateful for the privilege to just, be with community, be with our patients, be with our city. It's just a privilege. And that's what I love about my job, being able to do that and being able to not, people come to you with all levels of emotions, angst, fear, sadness, anger, even. But I appreciate the privilege of being that person who gets to sit in front of that human and hear them out and hopefully shift their perspective to one of hope.
Dr. James, thank you. We could go on and on. So I'm just going to go ahead and let you get back to taking care of patients. And I appreciate you. Let the staff know, though, I said hello. And we'll talk soon.
Thank you so much, Jimmy. Thank you.
Right. Thank you, Dr. James.
Take care.
That was definitely an awesome time with Dr. Thea James of Boston Medical Center. They reached out and wanted to come have a conversation with the community. So please share this on your page. It's been an interesting morning in the Java Cafe centered around healthcare. And so it is definitely important. That is one of the premises and foundations of Java with Jimmy. So I appreciate all of you that have endured the 9 a.m. with Mass General Hospital, the 10:15 a.m. with Dave Halbert, and also the 11 a.m. With Dr. Thea James. And so thank you all. Today is Tuesday. We will see you tomorrow morning it's Wednesday, tomorrow morning at 9 a.m. Have a great day, everybody. And again, thank you all for tuning in. Much appreciated.